You're welcome to another wonderful episode, Enlightenment Series with Aliola. This particular video will be talking about the difference between first aid case, medical treatment case, and restricted Workday case. Most times, we already know this, but most times it's an opportunity for us to learn on many of these things. First aid case is very simple. This is a case that has to do with an injury that involves first aid treatment. A first aider comes, treat the person, and the person is able to resume back to work in full within 24 hours. That is first aid case. If you are talking about medical treatment case is a bit severe than the first aid case, in the sense that beyond just first aid, it requires the attention of a doctor or a physician who is going to attend to the injury. And for a doctor to attend to a particular injury, it tells you that the cut, maybe for example your cut is deeper, or maybe the person went unconscious, or something much more severe than being given the first aid treatment. And most times maybe they go to the hospital, they get treated, but within 24 hours they are able to resume back to work, they are able to resume back to full capacity and return back to their normal working operation. While restricted Workday case is talking about when a worker is unable to resume back to his full capacity, is being treated, is beyond just medical treatment case. Medical treatment case, once they resume back to work within 24 hours, you still record it as medical treatment case. But if the person resumes back to work, but when resuming back to work, he's not resuming back to his full capacity, he's being given a lesser job to do, taken to maybe to another department just to do minor jobs instead of working in his own department, his real job, because of the injury that he has sustained, is unable to work normally based on his normal operation, and is taken to something more lighter. That is a restricted Workday case. So the number of days that the person spent will be calculated as restricted Workday case. However, one of the questions that I used to get is that when a particular worker who was involved in, let's say, lost Workday case, we'll talk about lost Workday case later in another video, maybe lost Workday case, he spent 3 days or 5 days in the hospital. When he resumed, he's unable to resume back to his full work and start doing lesser job, minor jobs. Will you still be recording it as lost Workday case? Or since he already resumed from his lost Workday case, definitely it should not be calculated again? No, it's not like that. If he's resuming from lost Workday case and he resumes back to work in full capacity, then you don't calculate restricted Workday case. But if he resumes from a lost Workday case and resume back to work, and because of the nature of the illness is not fit to work up to full capacity but can still work and it's giving minor job, you calculate restricted work for those days that he's been given a lesser job to do. And from there, once he's now fit to do the job, then stop putting those records into your documentation. And I hope that answers that particular question. Next time we'll be talking about the difference between LTI and lost Workday case. Yes, they might sound similar, but there are differences. What are the differences between LTI and lost Workday case? See you in the next video.